Hello, welcome back to the Washington Health System Friday video series. My name is Brook Ward. I'm the President and CEO of the Health System. My honor to be back with you today for our September 4th video. I want to start with some reward and recognition we've received since our last video. The first one comes to us from the American Heart Association and the American Stroke Association. They have given us their Get With the Guidelines Gold Stroke Plus Award and the Target Type 2 Diabetes Award. We're the only organization in all of southwestern Pennsylvania who have received the Get With the Guidelines Gold Stroke Plus Award for the last 10 years in a row. This is in recognition for applying the best and most up-to-date evidence-based care and treatment guidelines for people who have stroke in our community. So you know when you come here, you're getting the best treatment you can get for stroke care. Our second award comes from the Hospital and Health Association of Pennsylvania, or otherwise known as HAP. They give out achievement awards every year, and they have a category called Optimal Outcomes Award. We're lucky to be one of 13 recipients of that award this year, and that is centered around a program called the 4U program. This was a program that was suggested to us by Dr. Malay Chef. He talked to us about the fact that when we have an emotional, sometimes unexpected outcome or death, we often have resources to help the patient and the family get through that. But we have nothing for our clinical team and our caregivers. And that old adage where people should just suck it up and get back to work isn't healthy. And we agreed. So about a year ago, we put together this program called the 4U program. It's a team of nurses, doctors, and others who are trained to respond to the care team, the clinicians, the Washington Health System employees who are also involved in those events to help them get through that scenario. And this new HAP award recognized us for having, I think, the only program of its kind in the state of Pennsylvania to help our care teams. And so we're happy to receive that award from HAP. The next award we got was from the American College of Cardiology, and it's around our heart attack care. They gave us their NCDR Chest Pain MR Registry Silver Performance Achievement Award. Again, this is due to the hard work of our cardiovascular team and emergency department for caring for people who are having a heart attack by following the utmost and highest level of standard of care and achieving great outcomes. We're very happy to receive that award, and I just want to say thank you to our entire team. All of the folks in every department of the organization has to work together to achieve these outcomes. And I want you and the community to know that we're doing it to make sure that we can provide great patient care to you every time you come in. And these are just a few of the accolades we received recently. But thank you to our team. Next, I want to talk about some of our graduations recently. We've had a few. The first one I want to talk about is the Washington Health System Medical Assistant in Training Program. This is a first of its kind in this area. We, like all health systems, have struggled recently to find medical assistants to work in our physician offices. So we put together a training program where we actually hired 4 individuals off the street. These are people who didn't have prior healthcare or clinical experience. We worked together with a local program to put together. We partnered with Career Steps to provide didactic online coursework where they would essentially complete an online medical assistant school. Then they did their clinical rotations through every one of our physician offices in the WPG and with the Washington Health System residency program. So after completing all the online course and over 300 hours of clinical time, they also did training in the Rice Family Energy Center Simulation Center here at the Washington Health System. So this is a simulation center provided by the Rice family where we can train doctors, nurses, and others. And so these folks spent time in the simulation center doing their hands-on training in that environment as well. So the good news is, after 5 months of hard work and training, these 4 individuals graduated on August 17th, and we had a ceremony for them on August 28th. All 4 of them now are taking jobs in our physician practices. We're very happy to have them on board and as part of the family. Now we're getting ready to run that program again. So if you or a family member are interested, please go on our website to look for that opportunity. We'd be happy to have you in that program. Now, the next program I was going to talk about is one called the Washington Health System Phlebotomy and Training Program. And actually, the MA training and program I talked about was modeled after this. We started this program for the phlebotomists about a year ago. At that time, we hired 6 people, again, off the street who had no prior clinical experience. In that situation, we partnered with Penn Commercial locally to provide the didactic and schoolwork. They did the clinical rotations at the Washington Hospital. And at the end of the program, all 6 individuals were guaranteed a job at the health system. Now, in both cases, both the MA training program and the phlebotomy program, we provide and pay for all of the schooling, so there's no cost to these individuals. But there is a commitment that they work for us for some time after that. We're getting ready to do the phlebotomy and training program again here soon. We're going to start that program in October, so if you're interested or know someone, you can go to our website, WHS.org, And on the left-hand side, you go to the menu, there's a menu button called Career. If you hover over that, it comes up and you can see Career and Education. And then from there, you can click the Career Opportunities section to find that program. The last program I wanted to talk about from a graduation perspective is our School of Nursing program. Our organization was created in 1897, and when the hospital was created back then, the School of Nursing was created at the exact same time. So we've been involved with medical education since the very beginning. And because of that, we recently, on August 20th, had our 123rd graduation ceremony for the current 26 nurses who graduated from that program. They represent the April 2019 cohorts who started a 16-month RN diploma program, again, our 123rd such program. So congratulations to all the brand new RNs who graduated. All of them are going on to jobs. 100% of them got jobs in the area, so they'll be serving patients in Washington, Greene, and other counties. We had a number of them join us as well, and so I wanted to congratulate them as part of new members of the health system family. That's Nicole Carson, Lisa Conaway, Lexi Crawford, Ally Frederick, Paige Gallatin, and Nick Olson. So congratulations to all 26 graduates, including the ones who are going to be working for us here now. I also wanted to stop and just thank and congratulate the valedictorian of that class, and that's Mia Chernick. Now, moving on to some other topics, wanted to update you on some of our new physicians. We're always recruiting great talent at all levels, including physicians, but when they arrive, I want to make sure you know they're in our community to help serve you and take care of you. So we had a number of them join us here in the summer. The first one is Dr. Julianne Corcoran. She's a general surgeon who joined the Washington Health System General Surgery Group on July 1st. Then we had two physicians join us on August 1st. The first one is Dr. Damian Garcher. He's with WHS Urology. And the second one is Dr. Marcus Madger, who joined Washington ENT. At the beginning of September, we had two physicians join. One of them is Dr. Molly Philbin. She joined Washington Peds. And the second one is Dr. Ellen Philippi, who joined Washington Health System Lakeside Primary Care. And then the last physician who's going to be joining us in a few weeks is Dr. Brian Lockmeyer, who's going to be part of the Washington Health System Behavioral Health Psychiatry practice. So lots of great new people joining the organization to help care for each and every one of us. Next, I wanted to talk about UPMC Children's Pediatrics. Many of you know we've had a Children's Express here on our campus adjacent to the ED at the Washington Hospital. That was set up to be an after-hours, essentially pediatric urgent care clinic. And so it's open and operational after the pediatric practices in the local community close. That way, if you need something for your kids, you don't necessarily have to go to the emergency room, you can go there. And that's been very successful. Well, I'm happy to tell you that UPMC Children's is going to be bringing some pediatric subspecialists to use that same space. So starting very soon, they're going to have pediatric endocrinology, pediatric GI, and pediatric neurology functioning and seeing patients in that same location here very soon. And they're going to add other specialties to that as well. Now, the Children's Express will still stay operational and share that space with them. So we're happy to bring more pediatric care to the community to help care for our young ones. Now, the last topic I have for you is a topic around our foundation. As you heard earlier, our organization started in 1897, and from the very beginning, the community has been supportive of us in both their time and their financial resources. And to give you a small example, back in the 1920s, the community decided we needed a new hospital. And so the community, raised over $800,000 in 1 week to help fund and build the hospital at the location where the Washington Hospital still sits today. So they've been involved and supportive since the very beginning. And every year we have thousands of people who donate to our foundation to help support the organization, its critical services, and keep us independent. And we're thankful to each and every one of those. But there's a subset of that group that I wanted to talk about today, and that's a group called the 1897 Society. This is a group of individuals who not only support the mission of the Washington Health System, but they also support the mission of our Washington Health System Foundation. They're actively engaged in the organization and they want to see us succeed long term. Now, to be a member of the 1897 Society, this group of individuals has to commit to provide and donate over $10,000 over the course of 3 years at a minimum. Many of them commit and donate much more than that, but that's the minimum threshold. If you're an 1897 Society, what do you get for that donation? Well, first and foremost, we hope they're happy for their support for the organization. But in addition to that, they get invitation to an annual 1897 Society dinner where we get together and network, give them updates about what's going on in the organization. But in addition, they get to see a pinning ceremony for new members of that society. On top of that, we do educational events throughout the year that they get invited to, and occasionally we do a behind-the-scenes tour of some areas of the hospital when patients and family members aren't around. So they get sort of a behind-the-scenes look from time to time, some sort of interesting access. Now, to date, we have 90 1897 Society members who have committed over $4.4 million to the organization. We're very thankful to each and every one of them, along with all the other donors. Don't get me wrong, we are thankful to everyone, but I wanted to have a nice shout out to that group today. Now, if you're interested in learning more about the 1897 Society, you can go to our website to learn about that as well. You need to go to Washington Health System or WHS.org. On the left-hand menu, again, if you look for giving, and then from there a sub-menu pops up and you look for ways to give and then 1897, you can click on that link and you can read more about it. Lastly, I appreciate your time and attendance. Thank you for watching our video. Hopefully you found the information useful. We're going to have our next video on September 18th. Until then, stay safe.